Namaste, and welcome to our continuing series on homeopathy with our beloved Dr. Pachegaonkar. When I was much younger, I had some severe hernias, and the surgery was intensive. The scars are that long. Recently, my friend, an Aurobindo, had 2 hernias removed or healed through laparoscopy. Can you comment a bit on this?
See, this hernia is something which need not be removed. We call it repair.
Repaired, yes. That's
Because
correct, yes.
through some passage, the contents of our abdomen, they starts protruding out. It is within the body, but they protrude out through that what we call a inguinal ring, or sometimes even not through inguinal ring, because inguinal ring, if it is giving way for some protrusion, it is called as indirect hernia. And direct hernia is where the abdominal wall itself becomes weak and things protrude because of that.
So it's not a muscular thing?
Yeah, it is weakness of the
It is
muscles.
muscular,
Mainly it is weakness of the local muscles.
Right. And it protrudes through.
Protrudes through. So especially surgery is required in inguinal hernia, because this inguinal hernia, especially if it is indirect, there are chances that it may get strangulated. And strangulated means it can't be reduced by itself, and then it turns into gangrene and it can be fatal. So then under that condition it has to be operated under emergency. So what surgeons do is, once they notice hernia, they repair the area of the muscles which is giving opening for the protrusion. Earlier, the surgeons had to take incision and pierce through the whole abdominal wall to go and repair the area which is allowing herniation, especially in indirect inguinal hernia. And they were putting the extra sieve, a mesh.
Yes, a mesh. I remember that.
So that it is not allowed to protrude out. Now what has happened with laparoscopic approach, you don't need to cut the whole abdominal wall in layers. Instead, you pierce a laparoscope through a needle. It's a hollow needle, and through that we pass the laparoscope, and with another needle you can repair it. You can see it and you can put the sieve and put sutures. So wide incision is not necessary, and because the abdominal wall you are not opening, even the scar also will be just trivial. It can be like 2 mm, 3 mm scar.
And the healing will be much
just
faster,
one stitch, and so you don't require even hospital admission. You can go in the morning, get it operated, and you can walk out like that in the evening. And it doesn't require general anesthesia. The best part in hernia is we are not piercing through peritoneum. We are not going in the real sense of abdominal viscera. We are working just out of peritoneum, and therefore it's very simple and easy.
How do they mend it?
See, it is like, if opening is wide, they just put a mesh, extra force, and then
so
they
do put the mesh now.
Yes,
they still
yes.
put the mesh.
Yes,
Okay.
yes. So procedure is same. Instead of approaching through the incision and opening abdomen layer by layer to approach that area, they do it through laparoscope and do it. And laparoscopy is used for like number of surgical procedures, like gallbladder removal. Such a huge gallbladder also.
I had it.
They remove through laparoscopic surgery now.
Yes, it was, but it used to be a very serious operation. And now it's
that is for different reason also serious. What happens, we have seen a commonest complication of gallbladder surgery is, see, mainly if you are removing gallbladder because there are biliary calculi. the stones, biliary stones in the gallbladder. And when we are approaching through laparoscopy, in laparoscopy what happens, the lumen is very small. You can't take out whole gallbladder just like that. So with this laparoscope, the scope actually goes on, corroding the tissue and sucking it up through vacuum.
Oh.
So it takes say 1 hour, 2 hours. And when you are fiddling with the gallbladder, the muscles undergo some spasms and the calculi pass in the biliary duct. And we have seen that gallbladder is removed successfully with the gallstones, but the person has developed what we call bile duct blockage, because the stone got lodged into bile duct, and that is serious operation, more serious than this gallbladder, because that bile duct passes in the vicinity of pancreas, the most dangerous area to approach. Pancreas is very delicate organ. So rather, as a clinician, we advise that if gallbladder is to be removed and if you have calculi in it, then better go with open surgery. So en bloc you can remove it. Because 1 hour if you take to remove gallbladder, in that there is a possibility that calculus can get lodged into biliary duct. And we have seen number of cases where this complication has occurred, and funniest part is after surgery, after 3 to 4 weeks, the stone gets stuck somewhere in the bile duct. But as a complication of laparoscopic surgery on gallbladder.
I remember with my doctor, I had a little pain on one side. He said, "Oh, that's no problem. We're only concerned if it's here." And I think that was
pancreas, near pancreas.
Yeah. Thank you, sir.